right, great. All right, well, welcome everybody. We're excited to have you on the webinar here today. And I'm excited to have Tom Cooley with us here, CEO of GoCard Connect. Welcome, Tom.
Thank you. Thanks for having me. Really appreciate it.
Great. And so we're gonna dive in today to how you can easily improve your patient collections and retention. And I'll jump into some things that I've seen work for clinics, things that we did in our clinic too, that worked really well in terms of patient collections. And this will obviously spark some ideas too. Please feel free to share in the chat things that are working well for you too. We'd love to collaborate and share with the group here. We're sending this out to all of our clients afterwards too, so that they can have that information and knowledge too. So we're all here to help each other out. Obviously, this can be a tough area in the clinic, but with some control, it can get better, right? And Tom's going to also share with us things that we work together on for different systems, from anything from like online bill pay to different systems at the front desk that can help with collections. So he'll give us a little demo and tour of how those work. And we've seen that work really well for clients too. So we'll be diving into that today also. So let's jump in here on our goals for today's webinar. We're going to work on discovering strategies for getting buy-in from patients for paying, right? And then discover best practices for controlling front desk collections. So what's a good way of doing that? We'll look at the technologies here that can help you make it easier on patients to pay. And that's what we're really going to dig into here today. So I think we can all agree on some areas that can be quite frustrating and struggling, and collections can be one of them. Not only are we battling collections in the clinic, but also with insurance companies. But a lot does come down to, especially in today's world with high deductible plans and copays, there's more responsibility on the patient, right? And so we have to make sure that we have good collection actions, especially at the front desk, so that we get paid properly for our services. So when we have poor collection actions, this can result in patients self-discharging themselves due to a perceived value in your services not being as high as you think it is. There can definitely be a loss of revenue from that. We can experience lower profit margins. This can lead to poor patient results too, because patients may self-limit their care or they may stop altogether. That's going to definitely impact things out there for you. And that's going to give you bad public relations. If a client doesn't get a good result, are they going to be a good advocate for you out there? No, right? They might even say things that could hurt your reputation, even though it wasn't your fault. It was just the collections part of it, the finance part of it, the money part of it just wasn't handled as well. And then that leads to bad PR, right? And obviously, you're investing in your marketing, like we're helping you with your marketing, and there's a cost to that, to getting that new patient in the door. And if there's a poor collection action, that money is lost if the patient self-limits care or discharges themselves early. So it's a really critical area to look on. Here's some examples of financially why that's so important. All right, so let's say your marketing brings in 50 new patients a month, and at 12 visits per case, so let's say 3 times a week for 4 weeks on average, let's say you get $80 a visit per average. That's $960 per case, right? Or $48,000 per month from bringing in those 50 new patients. So that's $576,000 per year. Now, if that person limits themselves, right, from care because of financial reasons, then let's say we get 10 visits per case instead of 12. Well, at the same rate of $80 per visit, that's $160 less per case. That's $800, which means $40,000 per month, which is a loss of $8,000, or $480,000 per year, which is a $96,000 per year lost. Like, who wouldn't like an extra $96,000 per year, right? So it's just a simple matter of control here when it comes to making sure patients are coming for their full plan of care. So collections and retention here, this is our main focus. And what we want to look at is improving, delivery of care, patient satisfaction, like all those things in the clinic that you work hard towards with your clinicians. You want to work on the education part. This is going to help the patient fully understand their problem. And all the staff should be reinforcing the schedule for the treatment and the why behind that. And so this is where I think a lot of clinics, we're maybe a little bit weak in the training for our front desk and our billing, and then our therapists, just on like making sure that they really work hard on explaining to the patient the reasons why they need to be coming in for the frequency of treatment that's prescribed. And I have one clinic that I know of, and they actually, and I don't know how they got to this policy, but they got to this policy of seeing a patient one time a week. And I was like, what? I can't fathom it, because being a clinician myself, honestly, if you didn't have any financial constraints or insurance constraints, if you could treat a patient 5 times a week, you get amazing results for that patient in a shorter amount of time. I mean, I think we can all agree on that as therapists, that, if you're only going to see a patient 1 time a week, you're not going to have the same outcome that you could if you saw them more times in that week. So anyway, coming back to our collections and retention, you want to work on the follow-up procedures, patient surveys, those kind of things that can be done before a patient drops out. So if you have systems in place in your practice where you can survey, like what we did in our clinic was about the 4th or 5th treatment, we'd actually have the client do a little survey in the clinic, and we could get a pulse on where they were feeling, where they were at. So like if the patient was starting to say, I don't know if I'm making progress, I still have a lot of pain, well, that was sort of a red flag, and we'd let the therapist know, and they'd be able to handle that, because they had made some progress, but in the patient's mind, they hadn't made progress. So it's the therapist has to then, because they have that knowledge, be able to go back and make some different ways of explaining and show the results the patient has made. So all these kind of things do help in the retention part of it. All right, so I'm having a little trouble with my follow through here on the buttons, but professionalism is definitely important. Internal and external marketing there is a key component to getting the patient to agree that this is the right course of treatment. And then, of course, reducing financial obstacles. So the easier that we can make it for payment systems in the clinic, the less financial pain that our patients feel when they're coming for the treatment of care. So I have a quick question for you here, and maybe throw it in the chat. How much time do you spend on monitoring and evaluating your collections procedures? So let's see what everyone has to say about this. How much time do you spend on monitoring and evaluating your collections procedures? Is that an hour a month, a couple hours? What do you think? I love your honesty, Trevor. Not enough. Anybody else have an answer in here? How much time do you think you spend on monitoring and evaluating collections procedures? It's definitely not an area that's very exciting in the clinic, right? We like to see the bank account at the end of the day, but having to go through what are the processes to make sure that we're getting, the collections properly enough. Trevor thinks they're an hour every 2 weeks. So I think, it's an area that a lot of us can spend more time on. Another question here is, and this is, I hope everybody can answer this, is how much time do you spend training your front desk and therapists on sales actions when it comes to training around getting what the therapist and what the front desk can say to get people to commit to their plan of care? So any training that you spend on that? You can just pop that in the chat there. Okay, not ongoing, but I'm sure a little bit of time spent on that, right? Again, not enough. Yeah, so again, this is definitely what I see a weak area for clinics, is the investment in training. For therapists, we focus a lot on the medical training, right? On the techniques and the skills. But we don't spend usually enough time with our front desk, especially in how to overcome objections and the kind of sales techniques that need to go into convincing patients to invest that money in your care and services and how to overcome objections that happen with that. And then for therapists, how to sell a patient on the plan of care, right? Not necessarily from a financial side, but just the agreement part on why this is so important, how it's going to help you, and that message that needs to be there the whole time that they are going through their care. So let's take a little deeper dive here on the front desk and the admin sales side of things. So, sometimes you get this like weird feeling about sales, like the used car salesman, that kind of vibe, but it's not. Sales is actually a very good thing. You're helping the person get what they need, right? We know our patients need that level of care and they need that frequency of care. And so it's important that we help them get that. And that's really the mindset that you need to come from when you're training your front desk or having people train your front desk, that they're actually doing a sales action here. And that comes from an old derivative of the word selling, which means to give, right? You're giving help through that. So the whole point with the front desk here is that it's going to ensure patients come in for their full course of treatment. And the better that this is controlled, the better trained your front desk are, the more patients are going to come in for their full plan of care. And realize that the front desk has to be able to sell both on the phone and then, of course, in person. And this can dramatically improve patient satisfaction, definitely collections across the front desk, patient retentions, and that dollar value per case. That's why it's so important on this. So you have to look at what are my processes for training and drilling the front desk on training skills. So the front desk needs training on common patient objections. So, I can only afford to come in twice a week, right? How would they handle that, right? Have they had enough training or scripts or actual, pretending, the drilling part of it, on how to overcome those? How to handle objections for best patient outcome is really important for that. Do they stand up to face with the patient, match the patient's emotion? So you can see the patient's very, nervous, or the patient's kind of a little bit angry. They have to be able to match that to a certain level, but like with a calmness there. And, if the patient's angry, does your front desk get angry too when they need to kind of keep it calm, right? And so there's some practice that goes into that, some training. And this is what's called drilling, right? So drilling is when you're actually practicing scenarios, especially with the front desk here, in handling those objections until it becomes more comfortable for them, becomes more routine, right? So that's really, really an important training aspect, is not just telling them what to do, but actually having them practice. It's a key thing. I've worked for years with a good friend of mine, Dee Bills. She's with Front Office Guru. This is what she does, right? She helps train front desks on all the actions that they need to do to get people in the door for their scheduled appointments. Does a phenomenal job. So if you ever have a chance, check out Dee at frontofficeguru.com. She can really help you out there if that's an area that you feel you need a lot of help on. So the other thing with the patients here to help with this collections and retention side of it is to really be more proactive. So I'm sure a lot of you are doing this already, but if you're not, definitely make sure that you verify the insurance for the patient comes, before their visit, not only for yourself, but just to give that information to the patient. It's really nice for the patient to come in knowing what's expected of them financially and what their insurance is going to cover or not going to cover. If you don't have something like this, this is really a wonderful tool for you to be using in the clinic. It's your new patient packet. I use this a lot in my practice. This is something we put together for clients. So it's a nice folder with different inserts about what to expect on their visits. It has bios on the therapists, and it's presented there on the first day if they come in pretty soon, like after a referral. But let's say they're about a week out. Well, it's nice to be able to send this or mail it to them beforehand, because then you'll have a higher show rate of people coming in, and they're more excited when they're going to come in for help, knowing that you're the right solution. You've got this professional packet that you sent out to them. So on the evaluation on that first visit, what I'd recommend is that, they're going to obviously handle all the paperwork and stuff at the front desk, have their session with the evaluation with the therapist, but then who's going to cover the payment options and what's due after the eval. So let's say that person has a $2,000 deductible and that they haven't even used yet, right? And coming in for treatment that they're going to have to come in 12 visits and it's going to cost them over $1,000, right? Who's having that conversation? It shouldn't be your therapist, right? It should be a well-trained person, either at the front desk or if you have someone separate to at the front desk that can have this conversation and cover the payment options after the evaluation. If possible, a great thing to do is to actually, if that person is scheduled to come in for 3 times in that week and they're on the books, get them to pay one time for the week ahead. That's going to commit for them to come in and use those sessions versus getting them to pay at the end of the week for 3 sessions or day by day. That's a little trick that can help people to show up more for their prescribed visits. Definitely offer payment plans where appropriate. So, there's different solutions out there when it comes to payment plans. You can kind of do some of these stuff yourself, or there's different, like care credit and things like that out there. But, the bottom line here is what can you do for like bigger cases where you could spread it out over a couple of months versus everything in 1 month for that patient. And you'd get more of the visits in, you get paid over a little bit longer period of time, but the overall value of the case is much higher than limiting them on their visits because of financial problems on their end. And here's something that Tom will help us look at today too, is reducing the pain of handing over the credit card each time. So there are solutions out there that can help store credit card information safely. And if the patient comes in and your front desk is checking, hey, you're checked in, you're good to go. Would you like us to apply a payment on file? Boom, done. It's a lot less painful for the person than having to actually physically give their credit card over each time. So the less friction there is, on the front desk there. And that's where GoCard Connect is definitely helpful on that. There's the kind of a check-in process there without the patient having to give that card over each time. All right, so let's look at our therapist and their sales actions, right? So a lot of our therapists, they don't realize that they are actually salespeople too, right? They're selling their plan of care every single day, right? They're selling their technique, right, on the patient as they go along. And we actually had a business company come in and do sales training with our therapist one time. And it was phenomenal because our cancellation rates went way down after that. The therapists were doing a great job of getting people to come on their plan of care, and did a much better job of actually selling themselves, right? And selling the practice and selling the care that the patient needed. So the therapist must focus on the benefit of completing the course of treatment to get the maximum results. That's a big thing that they're selling there. And sometimes you can get resistance from the therapist, right? On that, oh, I'm not a salesperson, I'm a therapist, right? And I'd always ask the therapist, like, if insurance or money wasn't an issue, how many times would you need to see this patient to get the result that you wanted? What if you could see him 3 times a week? What if you could see him 5 times a week? Would you get better results? And universally, they'll say yes, right? So do the right thing for the patient. You're recommending what's the right thing to get this patient the maximum result. Let's not take money into that part of the issue, right? And the other thing is, it's important to train the therapist on not being reasonable about the amount of prescribed visits here. So again, this is where you might have had the situations where the therapist is going into agreement with the patient, like the patient saying, hey, I just can't afford this. How about if I come in once a week? And they're like, you know what? We'll make that work, right? So what they just did was they devalued their own services, because if they're recommending that patient comes in 3 times a week to get the maximum result, and then they agree with the patient that, you know what, money's more important, and I'm going to try to get you whatever result I can with 1 visit a week, they've just devalued their services. There should be a different discussion with a different person, payment options, whatever could be worked out there. I mean, you don't go into your cardiologist and say, you know what, I can only afford half of the heart surgery, right? Can we make that work? That doesn't make sense, right? So it's the same thing. We have to make sure our therapists know their value, be certain on the the prescription that they are prescribing for their plan of care, and make sure that they get that no matter what. And so it's important not to be wishy-washy about that. Now, a key thing here would be to look at what you're doing in the clinic to separate your therapist from the finances and the financial conversations about this. The job of your therapist is to medically diagnose and treat. And I think it's really important for the therapist to know when it comes to insurance, what they're going to get paid on certain codes and all this kind of thing. So I think that's really important. But what I'm talking about here is the financial conversations with the patient. That's where you kind of need to make sure that the therapist is not really involved in those conversations. They're involved more on, what is needed for the patient to get better. So wherever you can take that financial consideration off. So if that question comes up to the therapist of, hey, I just can't afford this. Well, you really need this, and I want you to get better. And what will happen if you can't get better? Will that impact your work? Will it impact your life? Like, let's focus on that. I'll have you talk to Lucy at the front desk or our office manager, and we'll see what we can do to work things out and help you out. That's where they should be able to pass it off to someone who's well trained, a designated person in your office that is very good with people, right? They're very good at conversations. They're a good salesperson naturally, right? Or has some training towards that, and they're able to handle that money conversation with the patient that's taken off of the therapist lines. And so then there's something that's arranged to help get the services that are needed, and then financially whatever is needed to be worked out in the clinic with the patient can be done. So the point there is, don't let your staff get reasonable about the money conversations that are happening between, patients, because there's a lot happening, obviously, in finance and the economy and all this kind of stuff, right? That we hear all the time, but it's really important for them to get the care that they need. All right, so when it comes back to, again, people wanting to pay for something and people wanting to commit to getting better, it's all about creating this big impression. So marketing helps you create that demand throughout the treatment cycle. And so that's really critical for you to look at your marketing processes from before the person comes in, when they come in for their evaluation, after evaluation, what's happening through every week that they're coming in, what's the touch points there that are occurring from a marketing perspective to keep the momentum going of the person realizing that this is a good financial decision for their health. Realize that, of course, website and social media are definitely a new face of your business, and there should be a lot of action happening around all those things there. You need to be able to leverage your patients to really gather a lot of online reviews. This is where social proof comes in. So again, like if the person has doubts on, I don't know if I am getting better, I still have pain, even though they went from like a 9 out of 10 to a 5 out of 10, they're going to look online on their own time. They might look on Google, they might look on Facebook, they might look on Yelp, and they see the results from people, and the review might say, hey, I came for 2 months and I'm feeling so much better. And they're like, oh, well, it's going to take a bit more time, right? So online reviews can really help you with those overall impressions and how people are, progressing through therapy. So it is important to just keep pushing on that all the time. Of course, a professional, clean facility makes a big impact. And I would say, wow the patient from the get-go. I think the new patient packets are really a very important tool, something we use a lot in our clinic. One thing I always looked at with this, and I heard this from patients all the time, is that, the patient comes in for their experience. They leave feeling hopeful, but then they have to go back to their partner or significant other and have the financial conversation. So what do they have to explain or show that this is a good investment for them to get better and get, healthier? So that's where, if you have tools like that for them to take, be in the household, it creates more of that understanding that you are the right solution for them. And then, of course, follow-ups and patient surveys, in the clinic, and the written iPad, whatever you have in terms of systems there for patient surveys is really important. There we go. All right, so what happens in the conversations with patients around collections when the insurance says no more visits, right? You've maxed out your visits, or we're only allowing 6 visits, or whatever the conversation may be. do your therapists give up, right? This is a problem, right? Because again, the therapist says, I need to see you for 10 to 12 times in order for you to get fully better, right? Your pain may be gone, but you still may be weak. You could have a problem come back in the future, whatever it may be. That's what the therapist said. It's not what the insurance company is going to say. It's what the therapist says. So this is where we again need to train our staff on not to be reasonable about patient care. We're not going to discharge the patient early because the insurance company said no, right? This is where it turns into the financial conversation with the patient. Like, you really need this help here. How are we going to pay for this, right? And your insurance company is not doing anymore, but we have payment plans and ways for you to afford this moving forward. So I would say a big part of this too, your insurance companies that give you a lot of trouble and having to do, paperwork to get another couple of authorized visits here. I would, especially with those kind of patients that have those insurance, have the conversation at the beginning, like, what we're going to see you for. I need to see you for 12 visits here. Your insurance is going to give us a hard time at about 6 visits. We're going to try to extend that, but there's a chance they may say no. But it's important that we get that care. And what we'll do is we'll work with you on a financial plan after that, if your insurance company doesn't pay after so many visits. So it's really more important that you get fully better, and that's going to cost you a lot less in the long run. Do you agree? Right? So those kind of things you would have, again, those kind of conversations with patients beforehand. Here again, you got to be able to offer payment solutions that work for both you and the patient. So I would encourage you to look at what you have existing, the things that you can add to make that better for everybody. And then obviously training your staff on these points and getting them on the same page. That's really important. Whole thing's about focusing on getting the patients better. So if you make that the primary focus, everything else can fall into alignment. But if you make money the primary focus, then you have these problems where people drop off a lot. All right, so looking forward here at decreasing financial obstacles, we got to train our staff with certainty. What type of payment, if like, instead of them saying, hey, your payment's due or something like that, where the person's like, oh, I can I pay that later in the week, or, whatever the objection might be. If you simply ask, what type of payment method would you like to use? It implies that, there's going to be a payment no matter what, right? And we just have different options for them to do that. The bottom line here is, if you were asked to pay for $960, would you pay it right away? Maybe. There has to be some sales behind that. If you're really tight for money, if you could say, hey, tell you what, if you could pay $480, sorry, this is a mistake here, a month for 2 months, would you be able to do that? Right? Then person be like, yes. So again, if you can work with, not for everybody, but ones that are going to be hardships or difficulty with finances, how can you still get the care that they need, the value of the case, spread it out a little bit? That can definitely help out both parties there involved, right? Sometimes as therapists, as practice owners, we get focused on, I have to collect the money this month. That kills a relationship and leads to the person, self-limiting their care. And this is where some people might have it, but again, like wherever you can in setting up your payment plan system, again, there's different systems and tools out there that can do that. And I would say too, like if you haven't explored this yet, where can you create monthly subscription plans for aftercare, right? So they came in for this. There's plenty of our patients that need ongoing care. We know that they may not be covered by Medicare or whatever their insurance is, but we know that they would benefit, we would benefit too. So look at some type of subscription model. It works. That's where like Massage Envy and all these places, it doesn't have to be a massage care model. It has to be a PT model or whatever it may be, but there should be some sort of subscription plan, things that you can do with that. All right, so we'll get into looking at the technology side of things here, with things that you can have here to make things easier to collect finances, right? So how can you make it easier to collect across the front desk? how can you have greater security in processing credit cards? How can you easier to implement payment plans and the ability to pay online through your website? This is why we work with GoCard Connect, because they can do a lot of these things for our clients and help with merchant fees and all kinds of stuff there. But a lot of it's on the technology side of things. And just kind of an example here. This is Willow Physical Therapy, but you can see right on their website they have a pay now button. So for any kind of collections that are due after the fact, this is very much expected now from most people when they go visit their doctor or anything like that. They expect an ability to pay online, right? And a lot of our different billing systems do have different tools, but having it always tie back to your website, it creates this whole brand experience. And so it's super simple. So if you have that pay now button, you just click on it and boom, you're right in. It's not through your website, it goes right through GoCard Connect's secure interface, right? So then you don't have to worry about, security or anything through your website. It makes it look like it's all coming through your website, but it's very secure through GoCard Connect site there. So again, online bill pay is a super easy feature there. A lot of our clients are taking advantage of that. So Tom will give us some insight into that, and then also sharing with us some of the other cool things that their system does to help with collections and payment plans and things like that on the inside. So I'll give it over to you here, Tom, and you can help us understand a little bit more of what GoCard Connect does.
Excellent. Well, hey, I appreciate kind of setting up all this up for this kind of showing me or allowing me to show the product a little bit more detail and give everybody a chance to see it, see how it works, and then also ask any questions. I've got the chat box open, so if anybody has any questions while I'm going through this through my maybe 5 minutes or so, feel free to throw a question up there, and I'll be sure to address it right away. I'm going to go ahead and share my screen so that way you can see. Let's see. I think it says host disabled screen share. All right, maybe see here now. There we go. All right, let's see here.
Great, I can see that, Tom.
Perfect. There we go. All right, so basically, Neil just showed you the host a payment page, and I had somebody else queued up already, Tennessee Sports Medicine. They're also a Practice Promotions client. And again, the pay your bill button is right there front and center. And as he mentioned, this is sitting on our server. So this is one of the reasons that Practice Promotions really likes this product so much, is it's not sitting on their website, their servers, or even your website. So you're completely out of scope for PCI compliance. Somebody comes to pay a bill and boom, it opens up on our server. This is where the transaction happens outside of your network. So it's super secure in the way the structure of the application. Anytime somebody makes a payment on this hosted payment page, you get an instant email notification of that payment. You're also able to see the transaction in real time on the back end called CardPoint. So any transactions you process are going to show up right here in real time. So if somebody were paying a bill on their website and for whatever reason, they dropped their laptop in the ocean and they couldn't figure out if they made that payment or not, they picked up the phone and called you, you'd be able to look and see right here that they did in fact run that transaction. One of the things that Neil mentioned something about setting up payment plans for your patients, and really kind of a more broader topic is the ability for you to securely store credit card information on file, right? So this is something that, with the ability to securely store information, you can always bill your patients when or if you needed to. And basically with every transaction that you process, both either on the hosted payment page or anywhere on our platform, you've got the option to securely store a payment profile without ever seeing or having access to the real credit card number. And I can show you what that looks like right here. So my son's name is Stefan, and I like to use him as a guinea pig. So I've got Stefan set up as a patient in my platform. So when I start typing in Stefan, the one profile that populates is my business credit card. And you can see the patient name is listed here as Stefan. So really easy for me to retrieve Stefan by simply searching for any criteria that I have listed with this payment profile that's connected to him as the patient. So if you can see this, this is what you're actually storing. This is the information that you're actually able to see and have access to within your platform. I can see it, I can show this to you because it's non-sensitive. I do have a Visa in my wallet that ends in 7408. It did expire, well, almost a year ago now, but it did have an expiration date of March 21. And this is the cardholder name on it. It also populates over here on this side. What you can notice here, though, is the first 12 digits of this credit card number, the 9460 number, is what's called the token, right? So these digits right here are unique to you as a merchant and Card Connect as a merchant processor. So if anybody else were to log in and have access to this information, this is completely useless for anybody except for you as a merchant running a transaction for Stefan as a patient and us as a processor. So in that way, it's hyper secure. And I think when I shared my screen, I lost the chat. So I just want to jump into that really quickly to make sure that I'm not missing any questions.
Yeah, no questions on that so far. And I think for people on the call here too, what's really good about this is, again, from the front desk perspective, can you imagine like if this is up, right? All they have to do is boom, check them in, add that in. The person doesn't even have to pull out their credit card. That's really a nice experience for the patient, right? And that things are there, easy check-in. There's no pain on having to give that credit card over.
Exactly. Yeah. So, and that's actually brings up a second point. So, if you're taking transactions face to face, so if the platform is available both as a hosted payment page only, as well as available for face to face transactions. Usually integrates with a terminal, which is patient facing, so the patient would tip the card, dip the chip, or swipe to pay, kind of like we do at the grocery store every day. And you're able to orchestrate the transaction entirely from this desktop. And what that does, it gives you the ability to capture information, perhaps like the patient name, email address. Signatures are no longer required for credit card transactions. So you can simply email the receipt and really turn your practice into a paperless practice. The only thing that's required when you're gaining cardholder permission for storing the credit card or storing the payment profile, let me correct that, is basically confirmation that the cardholder did in fact give you written or verbal permission, and how, right? So this is the only two things that we or the card brands are ever going to ask for in regards to you giving notice to your patients that you're doing so. A lot of practices include this information in their patient financial forms as part of a checkbox that patients are filling in when they're the first time that they're seeing you. So by including this, you're able to store this payment profile. Once you hit process transaction, then anything you captured with this transaction is storable and both searchable the next time that patient walks in. So just to kind of piggyback on what Neil just said, really giving your front desk staff the ability to really streamline that check-in process by simply seeing the patient walk in the door, and they can start really queuing up that transaction immediately. If they've already paid before, you're already storing that token. Running a transaction for that patient takes literally 3 seconds. There was another feature that you'd mentioned in regards to setting up a payment plan. So a lot of times it happens where the balance is more than the patient is able to pay in one given amount. So we do offer this payment plan which is kind of set up right here. Looks like a regular transaction. You can search for the customer. I'm going to type in Stefan again. Poor guy. You'll see the payment profile populates here. The payment, the payment plan options that we have is a really basic program, but you set up your start date. Let's say you want to start that on the first day of the month, and you want to bill every 1 month until it's canceled. So I'm going to show you really quickly what a membership or subscription model would look like. So this would give you the ability to charge your patients on the first day of each month with no end date. If you did want to capture only 3 installments, perhaps they have a large balance, they want to split into 3 payments. Let's say it's $450. Then it's really easy to set that up to capture these payments on the first day of each month for $150. Once you hit save plan, then this card will get charged on these dates, and there's nothing you need to do to check on it, right? The receipt will be emailed to the patient. The only time that you're notified is in the event that the transaction does not go through. If it gets declined or whatever the case is, you're notified if there's something wrong. But everything works like clockwork. You're not going to be notified.
I think for our
Also,
clients
if this
too,
is a little bit too far, I'm sorry. Go ahead.
yeah, I was just going to mention, from a practice standpoint, there's other options out there like Care Credit and things like that. When you go through Care Credit, you actually have to do. Patients sometimes don't want to do this because you're basically having to run a new credit line on them, basically, right? And they have to do an application there, and you have to get usually get the approval right away, and then you get paid right away, which is nice. But then you have to obviously give Care Credit I don't know, 5% cut or something like that on the amount. So you get paid right away, but then you have to have less money overall. And then you have the resistance of the patients not sometimes wanting to do their credit card application through that. Whereas if you're able to do something very simple type of payment plan, let's say, they're going to coming in for 12 visits over the course of the month, but then because of financial hardship, you're able to say, hey, you know what, we'll split that out over 2 or possibly 3 months. You're still then able to get all the visits in for them, spread it out, and again, you've given some nice options to the patient to get the care that they need, and you're still going to get good financial compensation for that. So it puts a little bit more of the ball back in your court when it comes to payment plans and things that you can offer in your clinic.
Yeah, thanks for mentioning the Care Credit. I actually asked that question a lot also, and this is just way more simple. The other option is you can set this up on a weekly basis. This may be a little bit too soon, but you could do biweekly, right? So if somebody wanted to pay every 2 weeks, then you could collect this in half the amount of time than doing it once a month.
Yeah. The other thing for our clients is that there's a lot of potential for cash paying patients too. And so one thing that we did in our clinic for cash paying patients was that if you paid for 3 visits, it was the regular per visit. But at six visits, if you prepaid something like a 5% discount, if you paid for 12 visits, there was a 10% discount. So you can calculate whatever you want to do, but it's nice to have that chunk of money up front, right? You've got a payment plan system that automatically is going to charge them on their credit card, over the course of the, maybe a weekly plan. But now you've got this cash paying patient. It's easy for them. They know they're going to pay a set amount per week. And I guarantee you, when you pre-collect on someone, they show up, right? They show up for their visits because they know they've already paid, and then they're going to get better. So it's really good for your cash paying patients too, that you have all these payment options and plans, because you can do better at collecting the money on the front end than per visit with those type of patients.
Excellent. Yeah, that's exactly right. Yeah, so that was really what I wanted to show you in regards to setting up payment plans, running a transaction, and using the hosted payment page to help manage your payments. The one thing I did want to add from a reporting perspective, you've got a lot of functionality that allows you to build your reports. You can even sort transactions based on how they're processed. So, for example, if you want to look at just your hosted payment page transactions, you could. You can even look at just your billing payments. You can see those as well. You simply choose your date range and any of the search criteria, and then that report becomes exportable into an Excel file. If this is helpful, if you're using an EMR that doesn't have a payments integration, rather than using a credit card receipt to reconcile your payments against your EMR, you're able to look at an Excel file and do so a little more thoroughly.
Mm-hmm. So, Tom, can you explain to us too? I know that there's a couple different options here. One is that you can actually use this system without having to change merchant processors. Am I correct on that?
That's exactly right. We have a lot of providers that simply just need to have a payment button on their website. They love this feature, and they would love to have just this payment option built for them, and we do that as well.
Mhm. Yeah. So we'll get to Trevor's question here in a second, but just on that, so the nice thing about GoCard Connect is that you can integrate with your current merchant processor, and you have this better system where you can collect through the website. It's much easier to collect through the front desk, and you also get these kind of payment options, and of course all the reporting and bells and whistles that go with that. But having worked with Tom too over the years, is they are super aggressive on their merchant processing fees and can probably save you some money on that too. So it's one of those where you can also have that option to look at GoCard Connect and CardPoint for merchant processing, which can help you a lot on reducing some of your expenses when it comes to credit card processing in there too. So something to talk to Tom about on that.
Yes, exactly. And so you can see our pricing is outlined at gocardconnect.com. Very straightforward. This lowest rates in the industry statement has been proven over and over again. So feel free to take us up on that. We also offer a meet or beat rate guarantee. So if you feel like you've negotiated a better deal with your current merchant service provider, let us take a look at it. Oftentimes we can reduce your cost significantly. Yesterday, I just worked with a practice. They have 6 locations. They're processing about $20,000 a month in credit card volume, and we were able to reduce their fees by 42%. That's
Wow.
huge. That was significant. It's over $400 a month that we were reducing their cost.
Mhm.
And in addition to that, they went from using a standalone system that just a regular credit card terminal where they're looking at the paper receipts and that transaction process is a little bit cumbersome, moving towards something like this where it's way automated. They're able to securely store the payment profiles, as well as have way more payment functionality and the ability to really service their patients in a more comprehensive way.
Yeah, so definitely it's a great thing to chat with Tom on that, not only for the system itself, but if you're interested in saving some money too with your merchant processing fees too, he can definitely help you out with that. Tom, Trevor had a question here. He says, if the patient pays on the website, then the info stored the same as when the front office enters it? Like, does it go into the system that way?
Great question. So when somebody runs a transaction here, basically the transaction will show up in real time right in your reporting, right here in the reporting tab. So that does not automatically store the payment profile, but what you can do is you click this transaction number, and it's going to pull up the entire transaction, which gives you full detail. And one of the options is to store that patient profile, or store the customer profile. They call it customers in this platform. So while it doesn't store it automatically through the host a payment page payment button, it does give you the option here to store it once you've processed it.
Mm-hmm.
Does that make sense?
Yeah, it does. And then he had a question. I don't know if this works too, but it said, is PayPal an option through that too, or is that just something that's different?
Yeah, so PayPal is our competitor, so we're not going to add them to our platform.
Okay, makes sense. Cool. All right. So thanks for showing us around the system there, Tom.
I hope I didn't put anybody to sleep.
No, it's great information on that. And, often we don't know that there's all these kind of, different systems to help us make things a little bit easier in the clinic until you actually see them. That's one of our goals here today, is just going to show you that there are solutions out there. And that's why we work a lot with GoCard Connect, because it makes it very seamless to offer those opportunities for the patient to pay through the website, but then also the nice features through the front desk systems there. And then of course, the low merchant fees are also another nice thing if you're interested in that too. So yeah, thanks for jumping on and showing us that there, Tom. I'll just
Austin had a question that I wanted to answer for him really quickly, if that's okay.
Yeah, absolutely.
All right, cool. So Austin said, is this a single user site account, or can groups with multiple clinics have multiple account logins to balance reconcile collections across company? And the answer is absolutely yes. So this was really designed for for a single practice or multi-practice. Basically, when you go to run a transaction, one of the options you have is to choose your location, right? So I've got two merchant accounts set up here just so you can see from the difference between the two. You can make one of these your default based on your user type. So you can have as many locations as you'd like to run transactions. So these are each individual merchant IDs or would be considered different merchant locations. You also have the option to set up as many users of the platform as you'd like. So creating users of the platform is quite simple. Usually is a first name, last name, email address, and then the user type. Admin kind of gives you access to everything, and standard allows you to pick and choose what functionality they would have access to, in addition to which locations they have access to. So it makes it real easy for you to scale this application across multiple different entities. So from a reporting perspective, you can also sort the transaction data by location, right? And you can even see one of the column options is even the user, right? So you can sort the transaction based on who ran the transaction, not only what the location was. So yeah, I may have gotten way geeked out over the answer to your question, Austin, but I'm super excited about this platform, and we've got practices with over 100 locations using this product, and it's beautiful.
Very cool. Yeah, lots of things that it can do. So you can have some simple functionality, or again, depending on your complexity of your practice and things that are going on. I think it's great, especially for multi-location practices, where they can see, who's responsible for, obviously running the transactions, where they came from, what locations, and things like that. That becomes more critical with more locations that you have, right? And keeping track and records of those things. So it's nice that it's all built in for that. Awesome.
And lastly, I know you put a practice promotions. You put the URL on this video. Feel free to reach out to me, schedule a demo. I'm more than happy to walk through this with you and spend more time and learn more about your practice and how this might be able to, be able to implement this in your practice and what that might look like.
Yeah, we'll pull that up there. Actually, if you want to type it in, it's if you go to gocardconnect.com/practice promotions, that's where you can easily request the demo and schedule a time that works for you. So there you go, gocardconnect.com/practice promotions, and you get right into the page here. It gives you some information again on the system, and then it's a way for you to schedule a time to talk with Tom and his team on that and get some more information on how that would work for you. All right, so we got time for another question here. If anybody has any other questions, feel free to pop that in the Q&A or the chat. We'll be happy to answer any questions you have there around collections or retention or the system. Cool. All right. Well, I guess we answered everybody's questions on that. So thank you, everybody, for jumping on here. Appreciate it. And thank you, Tom. It was great to always have you on here, and we love working with GoCard Connect. So thanks, everybody. And again, we'll be sending the replay out on this shortly, so keep an eye out for that. And thank you for joining us here today and for learning about GoCard Connect and for client retention. All right, we'll talk to everybody real soon. Thank you.
All right. Thanks, everybody.
Bye now.